Nursing students and nurses, listen up. Your documentation is more than just a task. It's your proof of care, your skills, and your decisions. One small mistake, it could lead to confusion, errors, or even legal trouble. But don't stress, today I got you covered because I'm breaking down how to document clearly, concisely, and correctly so you can chart like a pro from day one. Let's dive in. What is nursing documentation? By definition, nursing documentation is the written or electronic legal record of all interactions with a patient, including assessment, diagnosis, planning, interventions, and evaluations. Does that sound familiar? Documentation is your story of the care that you provided. It's how we communicate, how we protect and even improve patient care. So everything you document must count. Documentation serves the purposes of ensuring continuity of care. It serves as a legal record for protection. It also facilitates communication among healthcare teams while supporting quality improvement and research. Why nursing documentation matter? Let me emphasize, documentation isn't just paperwork or busy work. It's your legal shield and patient safety net. Remember, if it wasn't charted, it wasn't done. So let's make sure every detail that we document counts. Confidentiality is key. When it comes to nursing documentation, you got to protect the patient's information such as name, diagnosis, treatments, or anything that can identify the client. Also, avoid breaches, so no public discussions of any sort anywhere. You got to secure the computers, and for safety, no social media sharing, okay? Documentation, do's and don'ts. Hey, when it comes to nursing documentation, this is what you want to do. You want to keep to the fact, okay? Factual. Stick to the facts. No opinions, no assumptions, no biases. You want to be accurate. Double check entries for correctness and make sure you correct any errors. You want to be complete. Include all essential details, no gaps. And let me also say, you also want to be concise, okay? Anybody got time for dissertations, okay? So only keep to the pertinent details. Also, you want to be timely. Don't be lazy. Don't be procrastinating. Document as soon as possible. Your documentation should be thorough, precise, and fact-based. Now, what you're not going to do in these people's documentation is using slang, using verbiages that portray stereotypes, or even error-prone abbreviation. Only use approved abbreviations. Preventing errors in nursing documentation. Listen, abbreviations can be very tricky, confusing, and cause potential risk for harm on that patient. For example, a U, it could mean unit or be confused for zero. You also want to avoid trailing zeros and avoid error-prone shortcuts. So when in doubt, spell it out. What are the types of patient records? From paper to pixels, pixels meaning electronic device like a computer, patient records come in all shapes. You got EHRs for tech-savvy care. You also have source-oriented for discipline-specific notes, and problem-oriented for those problem-solving issues. Just choose wisely according to your facility. What are the different charting methods? There are various charting methods that you can utilize to document on behalf of your patient. One of these methods includes the SOAP method. The SOAP method has the subjective and objective data, which is explained in detail in another video. Now, the assessment portion here is basically going to focus on your professional judgment or your nursing diagnosis. It's going to include information like your nursing diagnosis, in which you're going to use the NANDA list if applicable. It will definitely have your clinical impression of what's going on based on the subjective and objective findings. It will also include your problem list if multiple issues does exist. Now, in addition to the subjective, objective, and assessment, you will also have a plan portion, which basically focuses on the plan and implementation that you are utilizing on behalf of your patient for good outcome. Understand that with SOAP charting, you have to be concise but very detailed. You only want to include relevant information. Of course, you have to avoid assumptions, document only what you see and hear. Use objective language, no opinions, just a fact, baby, because don't nobody want to hear anything extra. And then you also want to make sure you timestamp everything. Every intervention should have a documented time because it shows the flow of progress. Another method for documenting patient information or issues is the PI method, which is basically problem, intervention, and evaluation. PI documentation is a problem-oriented charting method that helps ensure clear, concise, and structured nursing notes. It focuses on the problem, the intervention, and the evaluation. Now, with regards to the PI method, the P is for the problem. It's basically talking about what is the issue. This will include information such as the nursing diagnosis, if applicable, but definitely will have the patient's chief complaint or issue requiring an intervention. It would also include the subjective and objective data supporting the problem. You will also have in this method of charting the intervention, which is basically what actions did you use to help the patient get better, and then the evaluation method, which is or portion, which basically is going to be an assessment of focusing on how did the patient respond to your intervention. Now, with the PI documentation, again, be focused. Stick to one problem per entry. Only one problem per entry. You want to be using concise language, no unnecessary details because ain't nobody got time for that. Timestamp your interventions because it helps with tracking patient progress, and you always want to link back to the problem to ensure documentation flows logically. Another documentation method is the focus charting, which includes data, action, and response, which basically centers around the specific problems, patient concerns, or the event. It's going to include information again, such as the subjective and objective data related to the issue. You will also include your action, which is basically the implementation portion of what you did to get your patient feeling better, and of course the response, which simply put is how did the patient respond to your interventions. Narrative documentation is like storytelling in nursing. It can be chronological. It has free text notes detailing patient status, care, and outcomes. This is the documentation that is like a mini novel, right? It can be flexible, but beware, without discipline, it becomes like a rambling story. So, therefore, you want to use it for unique cases, but you want to be factual, accurate, complete, and timely. You use it for situations that are like unstructured, for example, when you want to detail accounts of unique patient responses or a complex situation. This type of documentation is commonly seen in source-oriented records or in progress notes. How should reporting be done? Handoff reporting, like change of shift, are like passing the baton in the relay race. Smooth and precise. This is where you're going to utilize the SBAR or ISBAR, involving the patient and keeping it clear. Now, when it comes to change of shift reports, this is where you're going to include information such as the patient status, their care plans, and any updates. Now, bedside reports, which is where reporting should take place. This is where you're going to involve the patient for better communication. Understand something? Teamwork really does make the dream work. Communication is everything. SBAR and ISBAR are your secret weapons for clear communication. Whether it's a handoff report that you're giving to another nurse or a call to a physician, these frameworks keep everyone on the same page. You basically just talking it out. ISBAR takes SBAR up a notch. This is where you're going to include information like your identity or introduction of yourself. You're sharing the situation, you're giving background information, your assessment, your recommendation, and read it back. right? Now, I just want you to understand with the situation, you're talking about what's going on, what's happening right now. With regards to the background information, you're only providing relevant patient history. Relevant patient history. Your assessment is going to be your clinical judgment of what's going on with the situation. Okay, you've collected the data. Now, in the assessment portion, you're only giving your clinical judgment, and then your recommendation is what do you think should be done. Okay, this is mainly used when you're giving handoff report to the physician. And then, of course, you end off the ISBAR with a red back confirming the orders or the actions. Now listen, I need you to understand, when it comes to handoff reports, please keep it clear, concise, and patient focused, okay? Don't nobody want to hear about your personal drama, okay? Ain't nobody got time for that. HIPAA and patient privacy. HIPAA, HIPAA, is your patient's privacy superhero. Patients have rights. They have rights to access their records, they have the right to update their information, and they have the right to control who can see their information. Hey, let's keep their trust and stay compliant, okay? Incident report. Incident reports are for learning, not blaming. It serves as a purpose to help risk management department to improve the facility system. In the incident report, you're going to document unexpected events such as falls, medication errors, skills errors of sorts. This is where you're going to document the event, but you're never, ever, 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 ever going to mention it in the patient's record. Never. The patient's record should never include the fact that an incident report was filed. Once again, this document, which is the incident report, serves the purpose of improving how the facility can prevent this error or near miss from happening in the future. Sample case study. Look at this case scenario here and let's put theory into practice. Ms. Johnson's case shows how good documentation can actually save the day. The poor example, what do you notice? You see it's vague and it's very risky. In the good documentation, there is fact-based, it's detailed, and it's legally sound. Which one would you want in your patient's record? You should always pick the good one. That's a hint for you. As the fantabulous nurse or future nurses that we all are, I encourage that we every day reflect, learn, and grow, and ask ourselves, did I document clearly today? Did I document effectively? Every shift, every encounter, every day is a chance to get better. Let's keep on improving and reflect on our documentation and communication skills. Final takeaways. Here are two simple formulas. Documentation equals protection plus better care. Communication equals teamwork plus patient safety. Document with care, communicate with clarity. Let's make every note and every word count. We got this. Thank you so much for watching. I hope this video helped you understand the concept of documentation and communication. Do you have any questions, or maybe you have your own documentation hacks? Please share them below in the comment section. Let's continue to grow as a community of nurses and future nurses. Bye-bye.